Ghana Red Cross Society was established by an Act of Parliament, Act 10, in 1958, and that established the Ghana Red Cross to be auxiliary to the government. So, Ministry of Health, Ghana Health Service, we collaborate with them and run this health promotion tip or health and social care in our communities. And that is where Ghana Red Cross play a very key role in this cholera intervention. So it is not a separate thing. We do it with Ghana Health Service in the field. Our focus is social mobilization. So Ghana experienced cholera outbreak last year, October 2024. And immediately they reported the outbreak at Adan West and Adan East. The Ghana Health Service, through the Director General, activated the public health emergency at all levels to respond to this cholera outbreak. And that is where Ghana Red Cross, we also started our intervention with a draft that was launched in December to our International Federation of Red Cross and Red Crescent societies. And luckily, it was responded. And January, we started the intervention phase of this cholera response. Our intervention started with recruitment and training of volunteers. So we recruited 250 volunteers and then 10 staff and then we started our training. So we started with the training of trainers, workshop. We trained 30 people, the staff and volunteers, and then we did the step down training in the regions that we're going to have these risk communication activities. Right? We train our volunteers to support these activities because normally Ghana Health Service may not have enough volunteers on the ground, and per our Ghana Red Cross Society structure, we have volunteers all over in the districts, in the communities. So once we train them, they are directly in the communities to offer these risk communication activities in the communities. And of course, most of the time we use the community volunteers because they understand the dynamics in the communities, and that is why we use the volunteers in the community. And normally they use their own language, and that is more understandable than bringing somebody from afar to come and educate the people in the communities. And that is where Red Cross, we stand so strong in the power of our volunteers to reach people with risk communication on health. We also train them on the oral cholera vaccine campaign. That is the tips so that they can also advise people the importance of the vaccine so that they can support the Ghana Health Service with the vaccination campaign. And of course, it was very great in that regards. Vaccine administration is the work of Ghana Health Service, but our volunteers also were trained in how to administer the vaccine. Of course, this one is not injection, so it's very easy to do. It's about dropping, but there are also techniques and how to drop so that you will not drop any of it on the ground. Because once one drop on the ground, it can also cause another thing altogether. So they are trained with the Ghana Health Service and expanded program on immunization. They were there to train our volunteers, and then we just gave them the campaign strategy to move in and then do the oral cholera vaccine campaign in the communities. Red Cross, we believe that it is not only giving education to the people, but then you also have to help them to fight the bacteria that is around. You know, cholera you can get cholera through poor sanitation. So this time we train our volunteers to also spray certain parts of the communities that we think that there may be a cholera bacteria around there. And of course, anytime we get the information that yes, somebody contracted the bacteria, we always want to go and then fumigate the place. So we fumigated washroom, we even fumigated dormitories of some schools that they kept. I mean, Winneba University of Education, Winneba. That is, there was a cases like that. So our Red Cross people with Ghana Health Service, the environmental health unit, we all went there and then fumigated the place so that this thing. So fumigation is very, very important because you may talk about it, tell them to wash their hands, but if the bacteria is still there, you have not done it. Once they touch it, it will come back. So for us, it is just to support the policy on Public Health Act that once you give education, you need also to provide the necessary equipment to support to fight it. So we donated 5 knapsack spray machine to Central Region, and then they use it for the fumigation in hospitals. I mean, we observe some of them using it in the hospitals and then other facilities within the region. Another package donated to the regions include hand hygiene set, that is hand washing complete set, the Veronica bucket, the tissue, and then soap to the regions to help with the cholera intervention in the region. We gave all our volunteers PPE to protect them because they are going into the community. So we give them nose masks, hand gloves, that's disposable hand gloves, and so that at least while they are going to the communities where it's affected, they protect themselves, and hand sanitizer also. We procured SBCC material, social and behavior change material, the posters, the leaflets, the communities, and then we posted some also in some vantage points so that communities will get knowledge about what we are telling them. I mean, full of visuals so that they will actually understand what we mean when we say cholera, what we mean when we say symptoms that they always have to look out for. So it actually featured more the key messages in the form of pictures to the communities to change behavior. So our target area was mainly where people are gathered. So when you look at marketplaces like this, a lot of people commune through that side, move around, and of course, our tradition of shaking hands is always there. If you see somebody, you shake hands, and this is the key medium of actually transmitting the bacteria when you get it. So we focus one public places like marketplaces, now lorry stations, because if a lorry station, once you have the bacteria, you join the lorry, and then right from where you are, you can move to the next region and then you get it. Ask yourself, how come cholera started from Adan West? Then within some few time, Adan East also got it. Look at even the distance. So you could tell that lorry stations too is one of the areas that we need. So we focus on the lorry stations. Then of course, schools. I mean, school children, once they are playing, you cannot restrict them. So we need also to go there to also give them the education. The vendors in the schools, because children go and buy food. Sometimes you go there and then the food is cold because they started from morning, and then around afternoon, these children are going to buy food. They get there, it's cold. So we also talk to them and advise them that at this period, they should not sell food when the food is cold. They need to warm the food for the children so that we all cut these things from spreading. and some of them understood. In fact, we gave them the posters and then we explained to them how. So the schools and then the vendors in the school was one of the targets. Now we also focus on funeral grounds, because funeral people move from so many places. So people travel so many, and they can pick the bacteria, and then once they get there and then they shake hands. And you know, at funeral ground, we always have to shake hands. So you cannot avoid it. And we are not saying that you should not shake. You shake the hand, but after that, sanitize your hand, or hand washing is important. So sometimes we will speak with the organizers of the funeral that please, it is important to set the Veronica bucket closer to a place that everybody can actually access before they even take something to eat. Not leaving them, our churches too is another thing that we cannot leave. The churches and the mosque, people gather, and where people are gathered, because we are social beings, we'll always have to touch somebody. I'm holding something. Oh, Charlie, get this thing small. Sharing. You know, when you are sharing food, you think it's only sharing of the food, but you are sharing something that you have no idea, because the bacteria, you cannot see it with your naked eye. But we always have to let people be aware that after shaking your hands or after doing that thing, make sure you wash your hand with soap and water. And that is the mosque, the same thing. We give education at the mosque area. We don't also leave the food joints, as I said, where people gather. We just move there and then also give them education. Apart from these public places, we also leverage on the community information centers in some of the communities. So our volunteers that we trained, they visit the CICs, and then they also communicate with the general public through that medium. So and then they talk more about the key messages that people are supposed to wash their hands. They are supposed to keep their food warm before they eat. They're supposed to also wash hand when in critical moments. Our international foundation donated so many vaccines to the Ghana government, and that also has helped to reduce these cholera outbreak, especially in central region. Our target for this response were supposed to reach over 150,000 people. Fortunately, we went beyond that. We had over 200% of our target. So we had 351,303 people reached in this period of this cholera campaign that we did. And these are the people we meet face to face during the market area, going to the market area, schools, and other things. But those people that we communicated through the radio activities, that one, they are not even part of this. But this is where we use the Kubo Collect to actually report on this, the number of people that we reach. So over 200% of the target for this year. So I want to stand on behalf of the government, although it's Ghana Red Cross Society, but on behalf of Ghana government and then the Ghana Red Cross Society, to express our sincere thanks to the Federation for supporting us in this cholera response. In fact, had not been their support, I wouldn't know how we'll handle this cholera issue, that the cholera outbreak. So we are so much grateful. Thank you so much. But of course, we also ask for more, because there are a lot of things that we need to do in the epidemic area. So thank you so much for helping.